Hey everybody, this is Dr. Daniel Choi here at North Texas Dental Surgery, Wisdom Teeth and Denture Implant Center, and I wanted to share a case in regards to gum grafting. This patient came in with very severe recession on a single tooth up front and had some questions in regards to whether he was a candidate to get connective tissue grafting done, or maybe even using what we call alloderm, which is human donor tissue. So wanted to kind of go over this case with you guys because maybe this can give you guys some information in regards to like what we're looking for to really see if you are a candidate for less invasive gum grafting procedures. So let's just jump right to the case. All right, so basically what we have here is obviously we see there was severe recession on this lower front tooth here, central incisor tooth number 26 is what we call it. One thing that we're concerned about when we're kind of going through a decision tree as to how we're going to, what treatment options we do have for gum grafting is we want to see basically how much bone loss there is. Obviously with this type of gum loss, what's going on underneath the scenes is that you have a severe amount of bone loss too. So there's something called biologic width where the gum basically stays a few millimeters away from your bone line, about 3 millimeters. So when we take a look, if we were to, I know this sounds kind of scary, but if we were to like kind of make an incision and kind of peel back the gums and see how much jawbone he had, you would see like, the jawbone is typically about 3 millimeters away from the gum line. So you'd see like the jawbone here, and suddenly dips tremendously here. And then the jawbone would be here and here. So again, I might have talked about, you might want to see some of our other videos that we have about gum grafting, but the reason why we do gum grafting is that your gum affects bone and your bone affects gum. And so they play off of each other. And so in order to increase the longevity of a tooth, basically what we want to do is we want to always make sure that we have healthy bone and gum around your teeth. That's why we're basically always worried about recession. If you start experiencing some recession due to whatever reason, maybe you had ortho, maybe you're just a clencher, aggressive toothbrushing, which is not usually as often the case, but whatever these reasons were that you have recession, the thing that we're worried also about more, seriously is about the bone loss, because the bone is what keeps the tooth in place, right? So it's a support holding your root in place. So that's really why we do these gum grafting procedures, to really retain that bone and gum. So whenever a patient starts experiencing too much gum loss over time, as you start experiencing a little gum loss, you start experiencing bone loss, a little gum loss, a little bone loss, and this pattern just keeps repeating itself. Well, then it's like, okay, great, we just need to do a gum graft to fix the issue. But the problem is that, earlier I did say that gum affects bone, bone affects gum. If you've lost too much bone, the problem is that it becomes very difficult to try to fix your recession defect, because the bone is a blood supply for the procedure. In fact, the bone, your bone levels help determine what the prognosis will be for our ability to basically regenerate your gum. And so jumping back to this case, we could see here right there, a close-up, we see, all right, what do we see? We see very minimal, what we call keratinized gingiva, meaning that thick pink tissue. Also, if I stretch this lip a little bit further, we would see what we call frenum pull. So that's definitely not helping the case. So those are two factors right off the bat where I say, all right, it's going to be very difficult to be able to treat this with the human donor tissue, alloderm, because of these, certain factors coming in play. Also because of the severe bone loss. The severe bone loss, the bone is definitely the blood supply for the procedure. So I would say the prognosis and the ability to properly treat this is compromised. Another thing I want to look at also is the CT scan. So this is a CT scan, and basically what I'm looking at is I'm looking at the tooth in profile from the side view, and I could see, all right, how much bone do we have on this outer edge? Because again, I did mention that's the blood supply for the gum grafting procedure. So this is the tooth right next to it. You see a sliver of bone up to here. This is the other tooth on the other side of it. Again, you see a sliver of bone up to here. And then one of the other central incisors, again, you see the sliver of bone up to here. Let's take a look at the tooth that has a severe recession. We see no sliver of bone. So again, the severe amount of gum loss has also affected the bone, and now our bone levels are down to here. So because we see so much bone loss there, our ability to use alloderm, which is definitely not only more technique sensitive, but it's very sensitive to in regards to, again, the blood supply of the amount of bone that we have there. Also, again, when we looked at the photos earlier in regards to what we call the frenum pull, if I stretch the slip, there's a lot of tension on this area. That's another thing that I'm concerned about. And also the minimal amount of thick pink tissue that you see on the adjacent teeth here, you don't have that here. You have like none of it at all. So those are certain factors in regards to what the treatment option at that point I had to recommend for this patient would be a free gingival graft, where we harvested that tissue from the roof of the mouth and transplant it down to that tooth. So yeah, definitely it is a little bit more comfortable because we do have to harvest tissue from the roof of the mouth, unlike the alloderm grafts, where again we don't have to go to the roof of the mouth. But in essence, to make sure that you have the best result from this procedure and to make sure that you're not wasting your time and money, that would be the decision tree as to why we decide that, you know, using your own tissue would be best for you in this case. So hopefully you guys found this information helpful. If you have any questions, please feel free to leave a comment below, and feel free to come on in if you have any questions and you want a consultation. Thanks again.